Welcome to Hot Topics. My name is Russ Knopp, and I am the owner of Comfort Keepers. At Comfort Keepers, we strive hard every day to help seniors stay independent and live in their homes as long as possible. At Comfort Keepers, we're proud again this year to partner with the Petoskey Regional Chamber of Commerce to bring you Hot Topics. We think this series is important to bring issues that are important to business owners in a timely manner. I hope you enjoy today's presentation. Thank you very much.
Welcome to another Petoskey Strong Hot Topics Focus on Health. I'm Nikki Devitt, president of the Petoskey Regional Chamber of Commerce. I'm very happy to be joined by two of the, rock stars from the Health Department of Northwest Michigan, Lisa Peacock, the public health officer, and Director Dr. Joss Meyerson. So thank you for spending a few minutes with us today.
Okay, we're happy to be here.
I know that you have a lot on your plates right now. I think it's safe to say there is nobody in anywhere right now that's busier than a health officer and a health department, as vaccines have been starting that distribution phase for the last few weeks. And so I think the really important thing is that I know you're fielding questions constantly, and the phones are not, just not stopped ringing, because people do have questions. They need to know, what sector am I in? When can I get mine? How do I get it? But it's different from county to county. So when listening to state advice or state directives, or your friend downstate who lives in Oakland County, it can be very different here. So let's just talk about a few of the things, first and foremost, that people should know. For instance, today, it was announced as January 11th that we have moved into 1B, but what does that mean in the phases of vaccination?
Sure, I can answer that. What 1B means is we are now starting to we have the opportunity to vaccinate people 65 years of age and older, as well as some of our frontline workers, such as people in education, childcare educators, people who work in the schools and childcare setting, as well as all of our first responders who can now get vaccinated as well. So that's that next group that we are now opening up and planning on working through, as well as continuing to vaccinate anyone in that 1A group, who would include healthcare workers and, of course, our residents of long-term care facilities.
So not the full 1B that everybody heard originally, because I know some people are thinking, well, I thought I was going to get into that. Well, you'll get there, just
right.
not,
and
you're not scheduling it.
Essential workers is a huge group, and lots of people are in, essential jobs for sure. And without choosing sides there, we are going to start this process, and we will get to other groups within 1B as we can, but we have to start somewhere, and it just takes time. So we're certainly asking for people's patience.
So let's say you're in 1B that is now scheduling in one of those categories that you just gave us. How do you go about getting scheduled to get a vaccine?
Well, I'll clarify something right away, and that is that we're currently welcoming people to fill out our vaccine information form on the website, which does not automatically schedule their appointment. There are some things about this vaccine around the storage and handling that are tricky, and around the allocations that the state receives from the feds and then are distributed to us, in that we don't know what we're going to be receiving until Friday for the following week. And so we can only schedule a week at a time, because we don't know how much vaccine we'll have each week. And so we are welcoming people to fill out that vaccine information form. We've had over 9,000 responses to it already.
Oh my goodness.
So there are lots of people interested in getting the vaccine, which we're thrilled about. But that gets you in the queue for scheduling. And so our goal is that we would have a robust list of people in the community who fall into these priority groups being vaccinated. So when we open up clinics and have appointments and vaccine available, we can call them in very easily. We're piloting today a new online scheduling link that can be distributed to people that we are ready for clinics that we have opened up. And that will happen through a targeted strategic approach so that the people who were intending to call in to schedule are able to do that. And it has to be done this way because the vaccine management is just different than a regular flu vaccine. We have to plan really carefully for how and when we're going to use the doses that we have. So I would just say, we really would like people to register on the website, or there's a new hotline that was stood up last week, and that was a partnership between Area Agency on Aging of Northern Michigan, United Way, and 211. And that number is taking information from any seniors who would like to register for the vaccine but don't find it convenient or possible to register on our website. And so I can give you that number if you'd like it right now, Nikki.
Yes, please, and we'll post it on our website. Go ahead.
Okay. It's 231-715-5557.
That is fantastic because that's an issue.
Yeah, and just know that hotline, all of our phones, our website traffic, it's been completely overwhelming. And so we've had, crashes of websites. We've had phone lines that have had to be shut down. Some health departments have had to lock their front doors because so much traffic is coming through the door looking for vaccine. We will get to everyone. We know everyone is important. And just be patient with us. And if you don't get through the first time, try again. Avoid calling the health department directly. That's not the right path. Either call the hotline or register on our online form.
And I think what you just said is so fantastic too, because everybody's got to have grace and space right now and patience. And I realize it's been a long, long pandemic already, and we're all at the limit of how much patience we have, but we're in that home stretch. And now it's more important than ever to understand that, as you said, this doesn't operate like a typical vaccine. You're not just going to, walk in and just walk through a little queue and be done and go. People have to be social distance. There's a viability as far as the vaccine once you open it. And I mean, there's so much that comes into play. There's the refrigeration that has been all over the national news that everybody's heard about. So remembering those things, if you are in a group that can start to get into the queue and get yourself registered to be scheduled, I think is going to be really important for the public.
And that is, and those are challenges that we are working through, but we cannot have a mass walk-in line-up vaccination like we've done in the past, or what we do with the flu vaccine, because of all the things you said and the need for social distancing and the limited number of doses and the cold chain management. Creates complexities that we are working through, and we're going to get to people, but it's going to have to be something where people are scheduled in so that we have the right number of doses. We don't want to waste doses, but we also want to make sure that we get doses into the arms of our citizens and we don't leave doses out either. So our goal is to use up all of our doses every week so that we can justify getting more the next week.
And that's huge too, as going back to what Lisa said, that people understanding that when you don't know how many doses you're going to get, you have to use what you have, and you have to strategize on how to do this so that you continue to get doses. And it's this way with every health department across the state. So we're in a very different boat, and everybody's is going to be different. So we're lucky that we have such a dedicated health department. And I'm, from myself and the businesses and all of the community, thank you for what your staff is doing and has done. It's been an incredible journey. And now the big guns come out. Now this is the tough part, to really get through this. One question we're getting from businesses is that, say that we have, a restaurant or frontline service, grocery retail that's looking at the fact that, okay, we're coming up soon as far as my staff, my employees, my company. Who would be putting themselves into the queue, the individuals or the business itself?
Answer that. It is always easier for us in terms of recall if we have a point of contact. If that is their eligibility, is their employment, if the employer could fill out one form from the employer perspective and include all of their interested employees, that saves us a lot of steps. So we would prefer that. But if people do register individually and the business is registered, that's not the end of the world either. Once it comes in. But, as I mentioned, the volume of over 9,000 responses, the more we can condense that into groups that we can call in, the better.
We're happy to put that messaging out to the business community. I think anything that we can do to streamline, your efforts and focus and make it easier. Like you said, if you've got an employer that has 50 employees that are frontline and essential workers, and all 50 employees fill it out versus the employer filling it out and taking the employees and disseminating the information, that's a heck of a lot less. So we'll be very happy to push that messaging as hard as possible, because I think that'll expedite as things go forward too. A little bit of effort on our parts to expedite it for the following groups down the road as well, I think is good. I'm wondering if somebody can talk to, one of the things we've heard is, obviously we know that we need, we want 70% vaccinations, 70% of the population vaccinated to reach that herd immunity, that magic phrase we've heard all along. And you have a lot of people who are still concerned because it was rushed. And I think one thing that is messaging that we get across to businesses and when we talk to people is, when you have the whole world working on something, it's not so rushed as you think it is. It just happened a lot faster, but you had the whole world working on it. This wasn't just one company. And so when it comes to, is it safe? What's it do? Dispelling some of the things. It's not a live virus, correct?
Correct. It is not a live virus. So you can't get COVID from the COVID vaccine, correct?
Thank you. That's a big one out there. And additionally too, there was some stories in the early on before we even had our first doses released federally that, well, you're going to, it's the symptoms that, the symptoms are horrible. The side effects are just horrible. Side effects, from what we're hearing for the most part after the distribution, really are kind of like what you would get from a flu vaccine. You might feel a little ick. You might have a sore arm. You might even, have a few symptoms flare, but it's not as if you're incapacitated. And, for the most part, people are not having severe reactions to this, correct? From what we're seeing.
That is correct. Most people will get mild symptoms similar to getting any other vaccines, a sore arm where you get your shot, or you might feel a little tired or a little achy for a day or two. The younger you are, the more likely you are to have some of those, and your second dose, you may be more likely. And that's a sign that your immune system is responding to the vaccine. In a lot of ways, it's a good sign. If you're feeling it a little bit, that means that it's working and doing its job. Your body is making antibodies and doing what we want it to do. But the majority of people who get this vaccine have mild symptoms that really do not interfere with their life too much. Some, may have to just take it easy for a day, but the vast majority do quite well with it.
Good. And it is, as Lisa said, it's 2 doses too. So can somebody anticipate when they finally get scheduled, when it's their turn, that they will have to go back for that second one? And best not to travel in between, best to stay here. That would make things a world easier for everyone. Plus, you can still get and pass COVID before your booster, correct?
Correct. And the currently available vaccines require 2 doses, either 3 weeks or 4 weeks apart, depending on the brand. And you need to have the same brand. So it is best once you get your first dose to follow up with that same site because you want to make sure you're scheduled in to get the same dose. There's no data if you don't do it that way. When we have people come in for their first dose, we are scheduling them for their second dose. So people coming in, who are scheduling in, we're figuring that out to try to simplify. So at least it's simple to get your second dose if you come back here. If you travel and try to get it somewhere else, then I just don't know that you'll either be able to get a vaccine or what brand you may be able to get, because in different places of the country, even in different parts of the state, you may have different availability of different brands. What we're doing with here in our region is we're utilizing what we can get and using that. So 2 doses, 3 or 4 weeks apart.
Stay in the same spot. Go to the same facility that you got it from in the first place. Because look at it from this standpoint too, that's a wasted dose. If you get your dose and then you travel or you're not able to get another one because you were somewhere else, you wasted that dose, and that's not good for you or anyone else.
Right. I mean, we think you might get some protection from that first dose.
Yes.
But the studies were all based, the efficacy that showed that they're safe and effective, and that 95% is based on getting 2 doses appropriate of the same brand appropriately spaced. And if you don't do that, I just don't have any data to suggest how well it might or might not work. And you really don't get that full protection until about a week after your second dose. So that's certainly important. Even if you've had a dose, doesn't give you any sort of ticket. We all need to continue to be vigilant. Even after you've had 2 doses, you need to put your mask on when you leave your little area, your little isolated bubble. And we all need to continue practicing social distancing because, until we have that 70%, until we have a large number of our community protected, there's still going to be, unfortunately, viral transmission, and there's still going to be exposures to this virus when we gather. And so we're all going to need to be careful. We're all in this together, and we're going to have to just work through it together. And
it's so right too. Social distancing, mask usage, and the vaccine together. That they still have to stay together. Those 3 things. Just because you get your vaccine does not mean that you should stop wearing a mask or stop social distancing, because, as you said, we have to get the whole community to that point, or at least 70% of the community. So masks are going to be with us for a while, vaccine or not, and social distancing too. So we just have to, we made it through 2020. We can go through 2021. We're pros at this now. So we just need to keep going forward with that. What other things are you hearing?
The vaccine is I really do think it's our powerful tool. It's our way out of this, but it's not going to happen in a week or 2 or even in a month or 2. It's a process. But I think, and I know Lisa too, I'm excited. We have a way to fight back here, and this is great. So, but we're at the beginning of it, but there's light. So
there's light, and as you said, it's not going to be a week or 2. It's not going to be a month or 2. This is going to take time to get us to general population vaccination. Especially, there's no secret that how it's all rolling out is not what everybody anticipated. How many we'd have doses out by the end, or vaccines out by the end of the year. You have federal issues. You have state issues. This isn't going to be as perfect as everybody would like. So again, back to that grace and space and understanding that general population rollout is a ways off yet, but we have to just follow the protocol that's in place, because it is the right protocol to follow as far as vaccinating those who are the most at risk, not only for contracting it and having adverse effects to it, but also those who are most at risk for spreading it to everyone. So I think that what you do at the health department has been fabulous, keeping our community updated. And so if you're not following the health department on Facebook or their website or signing up for their newsletter, I highly encourage you to do so. And all of those links are actually on our website as well, on our Petoskey Strong Health page, so that we can keep putting out what you say, and just the more places it is, the better off it is. Is there anything else? What are the big things, before I take up too much more of your time, because I know it's valuable. Any other big messaging that you really want to get out to the community and the businesses in the area?
I would just really encourage that patience again. And just remember that, we started monitoring travelers right around the holidays last year. And so this pandemic started a year ago. And it took us a year to get this far. And, it's going to take us a year to get out of it. And the state has mapped out a timeline for the vaccination plan that involves, a really hardy goal of vaccinating 70% of the community by the end of 2021. Right. And so, we're thrilled that there's so much interest in the vaccine. We are very happy that we believe in the efficacy. We believe in the safety profile. We believe in the way it was rolled out. And so we know it's a good tool. We know it's a powerful tool, like Dr. Meyerson said, but we just do need some patience, because we just can't do it all at once. There are, strategies that we're using to work really closely with our partners. We are partnering closely with our hospitals. We got through healthcare workers more quickly than we anticipated. So we just ask for your faith in us, and we'll continue to do our best for the community.
Absolutely wonderful. Dr. Meyerson, do you have anything to add?
No, just, again, as Lisa said, I'm excited. I'm excited that people want to get this vaccine because it is safe and effective, and we're going to go as quickly as we can. And we're working, as Lisa said, with our hospitals and some of our providers, and hopefully as we get more doses and we're able as a community to help, really spread out this effort, things might be able to speed up a bit. But at the moment, like Lisa said, our doses are allocated on a weekly basis, and we just have to work with that and do the best we can.
And you are working with that so well. And something I probably should have pointed into and made sure that you had the opportunity to answer is that our health department is where somebody goes to get into that queue. Don't call your doctor, correct? And ask them, or show up at your doctor's office and say, can I have my vaccine today? Or again, too, I know that there's a lot of pharmacies that are distributing throughout the state the Moderna vaccine because the refrigeration isn't as much. Is that, if somebody's looking for alternatives, are those opportunities here for us? And that's what I want to make sure people understand too.
So just to clarify, the pharmacy partnerships that are currently happening right now with Walgreens and CVS, they have a federal contract to provide vaccinations to long-term care facility residents and staff and other kind of congregate setting residents and staff. So that is happening directly between those facilities and those pharmacies. There is no availability for the general public in those pharmacies right now. Maybe in the future. I know that certainly McLaren also across the state has a contract with Walgreens where they've been able to get some of their staff vaccinated through that contract. So we're looking at all kinds of possibilities like that. And we would be thrilled if we were able to establish more of those access points throughout the community. But right now, I would say that either calling the aging hotline, the number that I gave you, or going to the health department websites and avoiding calling the doctor's office, the health department, or the hospital to inquire would probably be your best bet.
Yeah.
That's the best thing to end on. That gives people two clear opportunities and options, and that is what everybody should follow. And that'll make it much easier for you and everybody else too.
Yeah.
Thank you both
Yes.
so much for taking time. And we'll check in again in a few weeks, hopefully, and see where things are as we start. Once we get to another point of another phasing, I'm happy to do this again. And as I said before, from myself and the entire community, we cannot thank you enough for all that you have done, as you said, in the last year, and that we still have to do going forward for the next year. So thank you very much.
All right. Thank you.
Thank you, Nikki.